Thank you, Madam Chairman, and thank you to the members of our panel today for being here and responding to our questions. Thank you also to the teams of people that you work with. Their tireless work over the last year and a half is something which many of us feel a great deal of gratitude for that effort. As we try and understand vaccine hesitancy, I'm sure some of that is due to spurious conspiracy theories. And perhaps, I don't know this, but social media may be populated in part by enemies of our country that are putting out theories to try and get people not to take vaccines. But there's also, I believe, another reason why some people who are not prone to believe those conspiracies don't get vaccinated, and that's because they don't know what the data really suggests. And they wonder, okay, is this really a good thing for my 16-year-old? What are the serious side effects of this vaccine for a 16-year-old versus the probability of them getting very ill? And I wonder, do we provide, or is there a place where people can go to find out what the data show for the side effects of vaccines by age group and how many serious complications there are for people of different ages, and then compare that perhaps with the serious implications of getting COVID? And I'll ask first Dr. Walensky. Yeah.
Thank you very much, Senator Romney. In fact, that's exactly what we are doing. So, one of the things I think that's so important to understand is that when people don't want to be vaccinated, it's for a whole host of reasons. And until you start talking to them about what is their reason, is it I can't take off work tomorrow and I may feel unwell? Is it because I don't understand these potential side effects for my 16-year-old? We at CDC have what we call vaccine confidence consults. So we have state departments, local health departments, who can call into us and say, these are the things that we're hearing on the ground. What is the real data, so that we can have trusted messengers providing that real data in real time to people and making sure that their questions are answered, and that we can empower the people who are the trusted messengers on the ground with exactly those data.
And is that information being collected? Are doctors and hospitals actually collecting the data that shows how many people are getting side effects by age group? Are you getting accurate information that people can rely upon? Because again, I see on social media and some broadcasters a sense that somehow this is being hidden, that the side effects are being underplayed, that you have an incentive not to let people know what the kind of side effects might be and the seriousness of those side effects.
And the answer is absolutely. We have numerous large-scale mechanisms by which to collect these data. We have the first ever V-Safe monitoring program, where people are in giving their vaccine. How did they do today? How are they doing in a week? We have the vaccine adverse event reporting system. That's a passive reporting system. Everything gets reported or is supposed to get reported, but we recognize it's passive. Things may get missed. And then we actually also have the vaccine safety data link, which is a link of 9 academic centers. So we're able to get real vaccine data as well as their denominators, which is hard to get in passive reporting. So we can check numerators and denominators and give us real estimates. We're covering the gamut.
The talk that Senator Burr described with regards to getting a booster, the suggestion from Israel is it makes sense. There are a number of us that would get in line to get a booster. How long is it going to take before we're able to get sufficient information to allow Americans who want to get an additional vaccination to be able to do so? Are we talking weeks? Are we talking months? I mean, I guess given the fact that this is being done overseas, can we not use the data that's come from those places to allow people in this country to get a third shot if they want to?
Yeah, do you want to
the agencies represented here are all monitoring this extremely carefully. As you've heard, 99.5% of all people who are being hospitalized now are unvaccinated. So at the moment, the people who are getting sick are the people who haven't been vaccinated.
I understand, but I'm looking at the data that's coming from Israel, and people who have double vaccinations are still susceptible to the Delta variant for serious disease and death. And they're showing that if they get a booster, that dramatically is reduced. Why should we not allow people who are elderly or have other compromised conditions to be able to get that booster?
Certainly. We're looking at all that. Remember, this vaccine right now, the vaccines that are under emergency use authorization, so it would require an additional authorization for a booster.
How long is that going to take?
Well,
That's the question. We have people who want to get that booster, and I'm hearing that from people who are at risk and concerned. They want to take that booster. They're willing to take the additional risk of something that's not been, they've already had 2 shots of it. They're saying, give me the 3rd because I got this over a year ago. I got the vaccination over a year ago. I want to get that protection. Why can't they? And if they, I understand you won't let them yet, but when will you let them?
Well, Pfizer at least has announced that it's going to submit to their EUA data, both Pfizer data and, to Senator Burr's early point, the Israeli other data that they have available to potentially make the case for a booster. So the FDA will be looking at that.
I'm sure you will. I don't like the time frame, frankly, given the fact that this is being done elsewhere. My time is up, so I'll turn back to the chairman.
Dr. Woodcock, for clarification, Pfizer has not requested